Great. Thank you so much, Cameron. Welcome, everyone, and congratulations on your recent awards. I'm Siri Schumann, co-director of the National Alzheimer's and Dementia Resource Center. I'm joined today with Erin Long of the Administration for Community Living and Kate Gordon and Stephanie Hughes, also of the Resource Center. We'll get started with our presentation in a minute, but I did want to let you know that the slides that we're reviewing today will be sent to grantees after the meeting, and we will also send a link to the NADRC website. I will turn it over to Erin Long at this time to begin the presentation.
Hi, everyone. I want to congratulate you all on your recent awards. We're super excited to have you as part of new members of our grantee family. I'm Erin Long. I am the team lead of ACL's Alzheimer's and Dementia program, and I also have a responsibility for oversight of the contract of ACL's National Alzheimer's and Dementia Resource Center, which in the coming months you will get very well acquainted with. Just wanted to go over our agenda. First, we're going to talk a little bit about what your cooperative agreement is. We're going to cover some grant management topics. We're going to review the project planning phase, which you are presently in, and then we're going to get into some reporting requirements and some questions. If we have time, we'll do questions and a little Q&A. So for the grant activity communications, basically your agency staff so there's you as the grantees with your program director, or some people call it the program director, some people call it the PI, the principal investigator, and then your finance person would communicate with ACL staff, and that would be your program officer, and I'm actually the program officer assigned to all of you. And then we also have our grants management staff, which help with some of the financial issues. They're the budget people, and they also provide tremendous insight in sort of helping us when there's questions about whether certain things can be done, or if we need to make revisions to your projects based on laws and regulations. They're the ones that can help us with that, but they also are the ones that set you up with the grant solutions accounts. You may have already communicated with the grants management specialist, Richard Adrian, through the negotiation period after when we were in the awards process. And then we also have the National Alzheimer's and Dementia Resource Center. Some of you also may have already heard from your liaison who each project is assigned a principal liaison and a backup, and we are very fortunate to have some tremendous experts in the field of Alzheimer's and dementia, so they help us and you refine your work and evaluation plans to deliver the most efficient and effective work and within the guidelines of you're set to, and also just the brain trust on what the things are that we've learned in the many years that we've been implementing these programs. Fortunately, Sari and her team have been providing technical assistance to ACL for many years, so we have a great amount of, a very significant brain trust within the Resource Center staff. So the first thing I want to cover with you is what a cooperative agreement is. Plain and simple, it just means that ACL and we will be involved in the planning phase. You have to get ACL's approval if you want to change things. We will be substantially involved throughout the duration of your project. If some of you are used to a research type project, which I often remind our grantees, these are not research projects. It is not a get the money and go away and do your work and come back. We're involved throughout the entire duration of the grant, and will be involved in ensuring that is carried out in accordance with the provision of the award. So there's two main roles that are laid out in your notice of award. You'll see that you have an authorized organizational representative, and that's usually the higher level staff person that's in a position to obligate funds. They've signed the application. The buck stops with them in terms of following the law and ensuring compliance, and that person provides oversight to the project director. As I mentioned before, the principal investigator / program or project director is the person that we would coordinate with on a regular basis. Day-to-day management, more often than not, they are responsible for the day-to-day management. They're responsible for the compliance with the program reporting, which is the narrative reports, as well as the financial reporting. While most organizations do have like financial experts in their organization, we still typically do most of our communicating through the project director. That's not to say that we don't are unwilling to talk to your finance people, but usually it's better to have it funneled through the program or project director just to ensure that everybody's on the same page. So you all should have your notice of awards. That is absolutely the official document connected to your grant. You will notice that it has what your federal award is and your match, your non-federal amount. Those numbers will not change over the course of the project. You do have the flexibility to make slight adjustments in the budgets, but for the most part, for all parts, the bottom line budget numbers never change. This notice of award is establishing your relationship to ACL. I would encourage you to look at beyond the first page are the terms and conditions. I think you should familiarize yourself with them. Sometimes the ones that we run into trouble with are salary caps and things of that nature that are included in there. It's just a good idea to look at those guidelines. And it tells you in your notice of award the dollar amounts that are available to you. So now that you have your notice of award, hopefully you've already reviewed it. You've already reviewed the policies and the terms and conditions. There is information about the financial transaction and the establishment of a pay account. In recent years, we've had grantees that sort of, I guess, thought that ACL just sort of sends money periodically, and that's not the way it works. So please make sure that you have established your accounts in the appropriate way so that you can draw down funds when it becomes appropriate, and also submit your financial reports in a timely fashion, which you'll get a whole schedule from our TA team to let you know when all those reporting requirements, the due dates. So the first time you draw down any money, that means that you have accepted all of the terms of the notice of award. It's important to understand that you are not, the expectation is that you do not draw down funds until you are needing to pay for something. So we don't typically do advance payment for anything. And that's pretty standard. So I would imagine that I believe most of you have had grants before, so that shouldn't be a surprise that we just pay for services as they're provided, not in advance. If you submit for payments for things that are unallowable, then you can expect that we would not reimbursed. So if there's anything that you're even slightly questioning whether it would be allowable, by the end of the planning period, there should be no questions, though, just make sure to talk to your program officer, to me, or your TA liaison, and we can help guide you through any questions you might have. So your notice of award as it stands now, it has all of the relevant, it has your end date, it has your, who your AOR and who your PD are. If you have a change to make to your project, you would have to request if you have a change for your project that is connected to one of the line items on your notice of award, it's not a simple process of you just telling us and we just make it happen. You have to, through our Grant Solutions program, which many of you may be familiar with already, you would have to request an amendment and formally submit it, and then your program officer would approve it. The grants management, then it goes through our grants management office, and our grants management official will sign it, and then it generates a new notice of award. There is a cost associated with generating new notices of award, so we don't take that lightly. We don't, not every change to your program requires an amendment, but if it's something that is connected to your paperwork, then we would have to do the full process. So Grant Solutions is the program through which we manage all of our grant activities. That is how your notice of award is generated through Grant Solutions. Your amendments, like I was just speaking about, those are managed through Grant Solutions. When you do your reporting, all of your reporting goes up and gets uploaded into Grant Solutions. That would be your semi-annual reports, your financial reports, those things. You definitely, so your key personnel, which are your AOR and your PDPI, should already have user accounts. If you have someone in your group that is going to be doing sort of handling administrative functions, we'll need you to request sort of an administrative account be open for someone. And the link here is to request that account. The Grant Solutions does have a help desk that is available and can help you in establishing accounts and other questions related to Grant Solutions. The information to contact them is in this slide as well. You will get very familiar with Grant Solutions over time, so and we can most certainly help you with anything that you encounter if you run into any challenges. So that is really, I think that is really my part of the presentation. And I think now we're going to turn to Kate Gordon, who is going to move us forward.
Thanks, Erin. And I just wanted to, again, congratulate everybody on this call for their successful proposals and the launch of your brand new grant with the Administration for Community Living. One of the intended outcomes of this webinar is to help to cover some of the terminology that we use as both the Administration for Community Living, ACL, and the NADRC, the National Alzheimer's and Dementia Resource Center, also known as just the Resource Center, so that as we launch your projects, that we're all staying on the same page. So I know sometimes it's really difficult in beginning a partnership and learning kind of the alphabet soup or the acronyms that we all utilize. So the rest of this call, we're going to spend significant time going through these terms that you saw in your notice of award so that you have a better understanding of what those requirements are moving forward. So first, let's start off with, as Erin stated, and is outlined in both the funding announcement and your notice of award. You are all in the project planning phase. So you have an approved proposal that was funded, but you're really yet to have an approved work plan, evaluation plan, and final justification, budget justification. So we're going to work jointly as the ACL Project Office Resource Center and you all as grant teams to develop a revised work plan based on the original work plan that you included in your application so that we all can see that it's going to accomplish both the grant that you proposed goals and objectives, but also specifically meet the grant requirements outlined in the funding opportunity itself. So you're going to be working with Erin closely over the next couple of months, as well as your assigned resource center staff, of which Erin mentioned that we have a lead staff member and a co-lead for each one of your projects. So you'll be talking with 3 folks from the ACL Resource Center side as you walk through developing a revised work plan. During this time, we'll also be first starting off with your work plan. Your work plan is then followed by an updated and detailed evaluation plan. So those 2 documents will talk significantly about having a mirrored work plan and evaluation plan. They work together over the full 3 years. At this point in time, during your planning phase, grantees only have access to 15% of the total grant funding to develop your implementation plan. So this is a terminology that we want to make sure you understand. It's 15% of your total grant funding. This is both the federal share as well as your matching funds, the full budget of your project. The 15% is the full budget of your project. It's a significant amount of money if you're talking about $1 million or more, but again, it's only 15% of the total funding for your project. At the conclusion of your planning phase, of which you have this kind of 15% of grant funding to play with, you're going to be going through this the planning phase where we're going to have phone calls regularly, lots of email exchanges. We're going to come as the ACL team and the NADRC team to clarify during phone calls, webinars, email exchanges, questions that we have about your work plan or your evaluation plan as we move forward. Once we get to the end of this planning phase, you have to participate in a very formal planning phase exit conference where you're going to receive both a verbal approval from Erin as your project officer as well as written approval in Grant Solutions to progress to your implementation phase. Once you get that approval, then you're going to have access to the remaining 85% of your total grant funding. But you cannot advance to that implementation phase or provide direct services without a planning phase exit conference. That conference approves, again, your work plan, your evaluation plan, and if necessary, any updated budget justification. So right now, as we're engaging in planning activities, you can use that 15% to pay for the salaries of the individuals who are participating in the planning period. If your budget stated that you're going to be utilizing grant funds to pay for the space that you guys work in or materials that you need, such as computers, that's part of that 15%. That's okay. But the direct services spending, providing services to persons with dementia and their caregivers, is not going to be approved for you to use your monies towards until that exit conference. Or in really special instances, you might be able to get a special access approved by Erin, your project officer. But for the most part, until you're out of the project planning phase, that 15% of funds is going to be spent on the time that you're spending in your planning phase itself and the staff time that's utilized for that in your project. The implementation phase is different in that that's when you're actively serving persons with dementia and their caregivers, as well as interacting with the public at large to increase awareness of dementia and brain health. So that's when you're going to be actively working towards your program goals and objectives, whatever outcomes that you've agreed on with Erin and the rest of the team. And throughout the full 3-year period, you don't just interact with the Resource Center and Erin at the beginning. We will be with you for the full 3 years, interacting and continuing to have technical assistance calls. Typically, once you are done with a 6-month reporting period, we'll have a check-in call to see how things are going. There will also be webinars that will be offered to you on subjects of interest in the space of dementia over your full 3 years period and beyond that. So those types of activities will be announced by the ACL staff and your Resource Center team as we move forward. So let's dive a little bit deeper into this planning phase. There are resources right now available to help you really understand what the expectations that ACL and the Resource Center have of what your final product of your work plan and evaluation plan will be. There's a URL in front of you right now that outlines that we have a webinar that's about 1 hour long that provides tips and tricks to help you move forward. It's well worth the time for you and your partners to view to understand, again, ACL's expectations of what's an acceptable work plan and evaluation plan. There are 2 templates, a work plan template as well as an evaluation template. There are work plan and evaluation tip sheets and a sample of an approved evaluation plan and a sample of an approved work plan. So you can see how others have forged the trail in front of you. There are webinar slides and recordings that are available on this link, and the work plan and evaluation plan templates are provided in Microsoft Word. Let me say that again. The work plan and evaluation plan are provided in Microsoft Word, and we request as the TA team and ACL that you utilize those templates and keep it in a Word format and not Excel. We've been doing this a while. One of the challenges that we have in working as teams that never see each other visually typically is that we need to be able to track changes in documents, and we've found over time that Word is just a better tool for tracking changes and making changes over time. So we would appreciate if you would please use the Word template that's provided on this website and not create your own in Excel. So let's take a look at what does the project planning resource guide look like. So here you'll see the two examples I'm talking about, one of a sample work plan and the other one of what are some of the things that we're looking for in an evaluation plan. So in both of these types of documents, we're not really looking for like a 27-page document, but we're really seeking a document that outlines who is doing what by when and clearly showing a framework of how you're going to meet the funding opportunity requirements. Both of these documents, both the work plan and the evaluation plan, ask similar questions and share similar content so that they can both be viewed as part of one project. We do ask for both a work plan and an evaluation plan because they have to be standalone documents in their own right. We frequently get questions from, for example, members of Congress that ask us information about what outcomes this ACL program is receiving from the monies that are given to us by Congress. So we are utilizing kind of these common documents so that we can aggregate what's happening across projects. So if we're asked what are the outcomes of the ACL Alzheimer's programs, we can easily look and aggregate from everybody's evaluation plan what those are and provide them on up the line. It also just makes it easier for all of us, as Erin has over 60 projects that she's the lead on, that we have a similar look and feel across all grants, just to make it easier to manage as well. So again, what we're going to find in these resources available on our website are these tips and tricks. When you drill down in the work plan sample, you'll see that we ask you to define your objectives, break those down further into activities, what tasks are needed then to accomplish those activities, and who's responsible for it. So again, who does what by when. We need to be able to see from your work plan very clearly that you are reaching the gap areas identified in the funding announcement. Those areas are behavior symptom management, serving people with intellectual and developmental disabilities, and individuals who live alone. So those should show up very clearly in your objectives. If they're not directly in your objectives, they should show up in your activities. We shouldn't have to drill down to key tasks to understand that you're meeting your 3 gap areas. A good rule of thumb under activities is to make sure that you're showing us the number of people that you are going to be reaching through your activities. So your objective is to, for in this example, deliver behavior management for symptoms, and the activity that you see in front of you shows that we are going to train 300 caregivers per year for a total of 900 caregivers. Right up front in your work plan, I don't have to, again, drill down into tasks or go back into your original proposal to find out the numbers of people that you are planning to serve. The activities are then broken down, again, into the tasks that are needed to accomplish the activities. We want to see that you've really pre-planned all of the steps to accomplish your objectives and activities. So we want to see that you've thought through how much time is it going to take, for example, to create and execute a contract with each of your partners, and who is responsible for that. How are we going to recruit people to the programs that we're creating? So how participants will be identified? How will your services be marketed? What's your outreach plan? We're looking for specifically what training or protocol are you using or are you developing? So in this example, you'll see that it clearly outlines that this grantee is using the ABCs of dementia that was designed by the university. They're going to be using a specific strategy and curriculum called the non-medication strategies for dementia behaviors. It shows up in your work plan exactly what you're utilizing. It's also really important that you are identifying in your objectives, activities, or key tasks the evidence-based or evidence-informed intervention that you're utilizing. So some grantees will say that, using this example, that they're going to deliver the Savvy Caregiver Behavior Symptom Management Training or some in the objective itself, or they might say in the activity that we're going to provide dementia training through Savvy Caregiver to provide dementia-specific behavior symptom management training to caregivers. Or in the key tasks, the curriculum that we're using is the evidence-based Savvy Caregiver intervention. So make it clear in either the objective, the activity, or the key task what your evidence-based or evidence-informed intervention is. We recognize that you did identify that in your original proposal, but we have to see it clearly in your work plan again to make sure that you are reaching all of the funding announcement requirements. Once you're done with this wonderful work plan that shows us your 3-year plan with the activities and tasks to go along with it, we're going to create an evaluation plan that, again, mirrors or matches the objective to objective, activity to activity. We then drill down further in this instance, not what you're doing, but what difference is it going to make? So we ask you to identify the outputs as well as the outcomes. So how many people are going to be served, which again is mirroring within your work plan. The outcomes, what change will they see? What are you expecting? What change are you expecting as a result of providing this activity through this objective? How are you going to measure them? What specific evaluation instruments are you using through your project to show that these outcomes were met? Now, there are some activities that you're going to have in your work plan that don't require evaluation activities. So we don't need to see an evaluation criteria for advisory groups, because typically that's things like, you had 25 advisory group meetings, people enjoyed being at the meeting. What we're really looking for are how did your direct services, the programs and services that you're providing to persons with dementia or their caregivers, what changes did those activities make? What improvements in the lives of persons with dementia or their caregivers? That's really what we're looking for in your evaluation plan. So we don't need to see evaluation measures for distribution of materials or marketing efforts to try to recruit people for your programs. But we do need more information about those outcomes that you're seeking. What data collection procedures are you going to be putting into place? Who's going to be responsible for collecting the data? How often are they going to be collecting the data? How are you going to manage that data? So that's the rest of this evaluation plan, is the data analysis and reporting. Who's going to do what by when? As I mentioned, you need to have an objective, outputs and outcomes for both direct services for persons with dementia. And I should mention as well that we also need to have outcome measures for if you are training professionals through your program, those also have to be evaluated. So if you provide, as I mentioned, Savvy Caregiver as an example of an evidence-based intervention, and you're training your staff on implementing Savvy Caregiver, if they're trained on Savvy Caregiver, then we need you to be managing an evaluation of their training as well. So if you're counting their training as direct service, then you need to evaluate and provide outcomes for that direct service. Your project officer and your resource center staff are here to help guide you through, again, the terminology and what may or may not need to be included in your evaluation plan, but these are just some tips and tricks, again, to be moving forward. So that was part of your planning process. So we're in your planning phase right now. You need to have the work plan, the evaluation plan, and the budget. There are also other reports and activities that you're going to be required to do and report back to the Administration for Community Living, for which we'll have conversations over your 3-year period. As outlined in your notice of award, you have additional reporting requirements. Erin mentioned that there are semi-annual reports. Those are due every 6 months. The program reporting is what we call it, the program progress reports, due within 30 days following each 6-month period. A calendar for that semi-annual reporting will be given to you by your resource center staff person after you've had some of your initial calls together. So you'll know exactly when the reporting period is. It started the first one started the day that you received your notice of award, or that your notice of award was dated, and it ends at 6 months. After those 6 months, you have 30 days to write up what happened during that 6-month period, and you send that through as a note in Grant Solutions. Stephanie and I are going to go through some of the requirements within those semi-annual reports. You will be providing ACL with demographic data for every 6-month reporting period. You'll also be providing a narrative report about activities that you have accomplished during a reporting period, as well as challenges that you may have faced. So for example, our grantees who are active right now have been reporting about the challenges that they have faced through trying to provide services during COVID-19. So the narrative report includes numbers of people served, challenges that you've faced. All of these reports are submitted again through Grant Solutions. At the very end of your grant period, so the 3 years are over, you've completed all of your activities, you will also have a final report that has the same kind of narrative that talks about what accomplishments were made during your grant period, as well as challenges that you faced. Those final reports, again, have a reporting timeline, gives you about 90 days after the end of your grant period to submit that to the Administration for Community Living. All of these, the data that you're going to be providing to ACL is going to be submitted in Excel format, and it's going to be cumulative from the start of the grant. And Stephanie Hughes, who's joining us in just a moment, is going to talk to you more about clarifying for you, what does that mean? Data should be reported cumulatively from the start of the grant. So from day one till the end of your grant, you're always reporting cumulative, adding on, adding on, adding on. We're not covering in detail today the financial reports that you're required to submit to ACL, but everybody's notice of award outlines that you have an SF 425 financial report that's due regularly. It's due annually within 30 days following each 12-month reporting period. You have to reconcile both your cash accounts with your expenditures for the reporting period and submit that cumulatively. Just like the final report for the narrative, at the end of this full project period, you are required to submit a full final financial report 90 days after the project period has ended, and reconcile all of your final cash portions to that as well. The lead on understanding your financial status reports is going to be Richard, so he's your grants management specialist. If you have questions about financial reporting, Richard is your key to financial reports. Again, those are submitted just like the narrative reports, just like the data reports, through Grant Solutions. Later on in today's call, Sari Schumann is going to join us to talk about the Dementia Capability Assessment, again outlined in the funding announcement. You are required to do a baseline Dementia Capability Assessment at the start of the planning phase, and every year in the fall, we'll ask you to resubmit or update your dementia capability of yourself and your partners. And then at the very end of your project, the conclusion of your project, we'll ask you for the progress that you've made in improving the dementia capability of your organization and your partners. So I'd like to pass the baton over to my colleague, Stephanie Hughes, to talk to you more about these semi-annual reporting components.
Thank you, Kate. This is Stephanie Hughes. I'm also a member of the National Alzheimer's and Dementia Resource Center. I'm glad to be with you today. Like Kate mentioned, I'm going to just spend a little bit more time here talking with you about the semi-annual reports that you're required to submit twice a year, and just a little bit more detail on what those will look like. So as Kate mentioned, those reports do contain two components. The first part is your narrative report, which will focus on the recent activities that have taken place over the past 6 months within your project. So that's going to include your recent activities, like Kate said, how many people you've served. You can highlight some of your accomplishments, share what challenges you've encountered and how you've addressed those. You can also send attachments that would include different products that you may have developed, like brochures or training curriculum. So that's what the narrative will look like. And there is a template for that narrative report that's included in the program announcement, or we can provide to you again later. So there's a specific format for sending that information. The second part of your semi-annual report is the data spreadsheet. Again, this gets submitted in spreadsheet form. This is a specific form that has been approved by OMB, so you do need to use the spreadsheet that we give you and to complete all of the fields when you're sending in your data. The data on this form is cumulative. Again, Kate mentioned this, but we just want to highlight it because it's something that has kind of tripped people up in the past. So while the narrative is focusing primarily on what's happened over the past 6 months, your data spreadsheet is always going to be cumulative, just starting from the first date of your project up until the last date of your most recent reporting period. The spreadsheet that you will use has recently been revised. We're in the process of finalizing that, so it will be shared with you soon. There will also be an entire webinar that's devoted to training you on this tool, so don't worry, there will be a lot more information coming, but we wanted to kind of give you a sneak preview today. And I do encourage you to check out the link here. You can see the proposed tool here. We don't anticipate that there will be significant changes, so it's a good idea to take a look and you can start getting familiar with what data categories are required. So moving on, we will just take a look at some examples of what you will be submitting to give you a sense. So within this data spreadsheet, the first category of information that you'll provide is in relation to the number of people with dementia and caregivers that you are serving with the direct service component of your project. And you will be asked to collect demographic data on these people that you've served. There are several different categories. These are just examples here. This is not comprehensive, but things like race, age, gender, living arrangement indicate, are these people who are living alone, living with a caregiver, that kind of thing. So that gives you a little bit of a sense of the data that you'll be collecting in that tab of the spreadsheet. The next worksheet within the spreadsheet is where you will report on the professionals who you're training. And these are broken down by the role that the person is playing rather than, it may or may not correspond to their specific job title, but we're concerned here with what type of role are they playing in serving people with dementia. One thing that we do ask when you're reporting on people that you've trained is that you're reporting on duplicated people served. That actually goes for the first tab as well, people living with dementia and caregivers. But if you are providing multiple trainings to the same person or multiple services to a caregiver, for example, you'll just count that person once. The next category within the OMB data collection form is direct service units. I'm not going to go into a lot of detail on this piece here, but that is primarily looking, it's used as a measure of the amount of time that you are devoting to each client or person that you're training. And I'll mention here too that there's also a very detailed document that provides definitions and covers some of the frequently asked questions in relation to data reporting. And that is something that will be available to you shortly as well and should provide you a lot of guidance and information. And our TA staff at the Resource Center is also always a resource to you as you may come upon questions when you're working on this piece. And finally, the last category of data that you will report on as part of your semi-annual report are your expenditures. And these are broken down into 3 categories. The first is direct services expenditures. The second relates to, actually I've listed them here in a different order. I guess the second I've listed here is administrative costs, which would correspond to things like time spent on reporting, on developing contracts, that kind of thing. And the third relates to other program expenses that are not actually direct service, but may relate to things like creating a new curriculum or having program planning meetings. So again, more details and definitions will be available in that definitions and FAQs document, but we just wanted to kind of give you a high-level overview today so that you are familiar with what is coming down the road. So again, I encourage you to take a look at that proposed data collection form. For those of you who may have been involved in past projects, you'll see that it is similar, but there are some changes to the form, so be sure to become familiar with those changes so that you are ready for data collection. And now I'm going to turn things, advanced too quickly there, turn things back over to Kate.
Thanks, Stephanie. So Stephanie, in her previous slide, had a description for us of the expenditures, really quickly, a listing of the expenditures that we might find that we need to report on in our OMB data collection tool. And I just wanted to make some clarifications on direct service expenditures versus the other types of expenditures that you might have with your grant. So besides direct services, how else might you be spending your money? So reiterating that over the course of the grant, you guys have agreed through signing your notice of award that you will spend not less than 50% of your total funds on direct services to persons with dementia and their caregivers. Again, 50% of your total grant funds. I said it before, I'll say it again, total grant funds means the federal funds as well as your own organization's matching funds, whether they be in-kind or direct matching funds. So the total grant funds, 50% of that total grant funding has to be spent on direct services. So direct services can include time or funds spent on behavioral symptom management consultation, professional training, evidence-based interventions, respite. There are a number of activities that count as direct service, but not all dollars spent in your grant meet the definition of direct service. There are other types of activities that you might be spending your funding on. So these include administrative expenses. So administrative expenses are the direct and indirect costs related to basically your regular routine grant administration and monitoring. So for example, when somebody goes in to put a receipt or get a dispersal of program funds, that's administrative activities. Preparation of your routine reports, whether it be the narrative report we talked about, the 6-month report, or the SF-425, the financial reports, that's an administrative expense. Keeping in compliance with grant conditions, or if you have some audit reports that need to be written, that's the administrative side. Administrative activities for a program coordinator might include working on contract development with your partners, solicitation, review, and monitoring of those contracts. So it's not 100% of a project director or a project coordinator's time is rarely spent 100% on direct services. So if they're spending time on administrative functions, that time is not direct service. So when you're looking at your budget narrative and you've said that 100% of my grant coordinator or my project director's time is direct service, think about whether or not they're doing administrative activities or even participating in other program expenses. So other program expenses, so time that's not direct service and not administrative, kind of a third bucket of how we spend grant dollars, includes this kind of other category. The time that we're spending on the telephone call today, this is not direct service time, but it's time that your project coordinator, your project director might be spending. Work plan and evaluation plan development time is a kind of this bucket of other programmatic expenses, not direct services. If your program has in its work plan that you're going to be developing new training curriculum for persons with dementia, caregivers, or professionals, the time in developing that training is considered other, not direct service yet, because you're not providing that directly to persons you're developing it. You're not directly providing that service. Any time that you spend in outreach, trying to recruit people to your programs, or marketing, trying to publicize your program, that's not direct service yet, because again, people aren't accepting your services, they're just hearing about them. It falls into this category of other program expenses. And lastly, any time spent on your evaluation activities or with your evaluation partner, those are not administrative, they're not direct service dollars, they meet this category of other programmatic. So these substantive programmatic activities that don't meet the direct service requirement, work plans, program planning meetings, doing a translation of an evidence-based protocol, developing curriculum, information dissemination, all of those fall under this kind of third category of other program expenses. So again, looking at your budget for your budget narrative, make sure that you haven't allocated 100% of a staff person's time who isn't spending 100% of their time in direct service. All of these expenditures are going to be reported in this OMB approved tool. It's an Excel document, as Stephanie mentioned. And again, you're going to be reporting on each one of these services or activities as a percentage of your total grant funds spent. I just have to reiterate it again. Total grant funds, or grant funds, mean your total approved budget, both the federal side and the non-federal side, or your organizational side, and those are cumulative over time. I promised you that we would continue on this course together in trying to decipher what the words that ACL or the Resource Center uses in comparison to what you might be using in your own organization. I just talked about what a direct service might be categorized by the Administration for Community Living, and that 50% of your total grant funds have to be spent in those activities. Sometimes people get confused between direct services and the direct service requirement for these grants and the match requirements for this grant. All of your budgets currently meet the required match as Richard, your grants management specialist, has negotiated with you. But just to be clear, direct services have to be 50% of your total grant services, and you as a grantee are required to provide over time a 25% match to the grant funds as well. And that can be either cash, direct from your organization cash, or it can be in-kind activities by yourself or by one of your partner organizations. So these concepts are different, but they are related because sometimes your match activities or your match dollars support direct services. And you'll be hearing from your technical assistance staff and Erin as your project officer about what does this count as direct service, is this part of your match, and making sure that your match dollars and services are for services and activities that are new for your organization and in support of this particular grant. So you cannot match activities that are outside of what's in your work plan. So if you provide caregiver services to the general population and some people with dementia, and there's nothing different or special that you're providing, that can't be used as a match to this program. It has to be something new that you have developed and that you're funding through this grant program. And Erin and your technical assistance staff will be going through that more in depth as you guys work through your work plans, your evaluation plans, and any changes that need to be done to your budget narrative. So everybody will be creating a new work plan. Everybody will be creating a new evaluation plan, and everybody will be likely updating their budget narratives over the next couple of months. That's part of the expectation of this program planning period. So I'm going to pass the baton once again off to Sari Schumann, our co-lead of the National Alzheimer's and Dementia Resource Center.
Thanks, Kate. Before I start, I just want to have Erin address one of the questions that's come in, and then I will give some description of the Dementia Capability Assessment. Erin?
So just real quickly, we received a question about work plans and having already submitted work plans. We just, the planning phase is the time in which we go through grantees' work plans that they've submitted. We have never had one that was 100% responsive to our program requirements, and we use this time to ensure that everyone is implements a program that is responsive to all of our requirements, that they are not using our money to fund programs that they've already done, that it's all new work, that it contains the level of detail that we require. More often than not, applications contain something that is very high, 40,000 feet overview. We require a very detailed roadmap to your project, including like getting down to the nitty-gritty of creating eligibility criteria, all the steps that are included, so that if someone were to pick up your work or your evaluation plan, they would know exactly what you're doing. We're also very sensitive to the fact that it's been a very long time since you put your application together. You might have learned something new. This is the opportunity not to change your whole project, but perhaps to insert something or adjust and pivot a little bit to perhaps address something you learned about later. But so just keep in mind that that's going to happen with your work and evaluation plans. Your documents will likely be very different, but the same. So hopefully that works, and if you need, we will certainly be discussing this at great length over the next 6 months. Thanks, Sari.
Sure. Thanks so much, Erin. So I'm going to take a few minutes to talk about the Dementia Capability Assessment that you will be required to complete at the startup of your projects, annually thereafter in the fall, and when you complete your projects. These Dementia Capability Assessments are conducted at the organizational level. So you'll choose one person from the grantee organization, and then your partner organizations will have one person provide answers to the assessment questions. You can see a little bit about what dementia capable systems look like on this slide. Due to time, I am going to move to the next slide briefly to tell you a little bit more about the assessment, which will ask you questions about identifying people living alone with dementia and their caregivers, staff training on dementia topics, specialized services for people living with dementia and their caregivers, and a few other questions. So one thing really nice for you is that the National Alzheimer's and Dementia Resource Center has put together the assessment in an online format that can be completed typically in 10 to 15 minutes by each respondent. This is the front page of the assessment, and it gets sent to each individual who will be responding to their personal email, and they can go through it. We usually give about 2 weeks to complete it, and then the responses all come to the Resource Center for analysis. So you don't have to ask your evaluator to do anything related to the Dementia Capability Assessment, gathering data or analyzing the data. That's something that the Resource Center does for the grantee program, and then we send you the results soon after you complete each assessment cycle. So just a quick glance at what one of the question pages looks like. There's some introductory questions at the beginning asking you just who you are and where your organization is, and if you're a grantee or a partner agency. Maybe you're a grantee on one project, but you're also a partner on another project. So we get a little bit of information about you, and then we dive into the questions of the actual assessment, asking about how you might identify people living with dementia and their caregivers, etc. So you might be wondering which organizations should be completing this assessment. So all grantee organizations must complete the assessment at every time period. And then project partners that are involved in direct service, so they're either providing services or supports to people living with dementia or their caregivers as part of your grant project, or they employ professional staff who are receiving dementia-related training as part of the grant project, will complete the assessment. We will give you all this information again as you move forward. I'm just giving you an overview right now. There are a few project partners that won't complete the assessment, including your evaluator. So it's only looking at those that are providing direct services. So another feature that you'll learn about with your grant project is the webinar series that is supported by the Administration for Community Living, and the Resource Center facilitates those webinars. The webinars are focused on dementia topics related to the grant project, and there's an archive of past webinars available on the Resource Center website that you'll be able to access. I'll also send out the web address for the website soon after this session, so you can go there and check out some of the documents that we've talked about during this session, maybe view a few of the webinars that might be of interest to you. We actually have a webinar tomorrow on assistive technology and dementia, and I can be sure to send you all that information this afternoon just as a reminder. So that webinar series, there are 10 webinars throughout the year, and we do hope you join us for as many as possible or watch the recordings after. So here's the front page of the NADRC website. You may have already visited it to see what we have available in terms of reports and resource guides and article resource lists, the webinar recordings, project profiles. There's really a great deal of information on here that you can access anytime, and we invite you to take a look at that and use whatever you need for your projects. So we've gone through a lot of information. We know you will have questions. Like Erin said at the beginning, you may have already been contacted by your Resource Center technical assistance lead. If you haven't, expect to hear from them soon. In the meantime, if you have questions, you can feel free to contact Erin or myself. Our information is up here on the slide. And we will take a few minutes. I think we have about 2 or 3 minutes to answer a few questions if anyone has others that they'd like to enter into the question and answer chat pod. Erin, do you have any other comments you want to make while we're waiting for a few questions to come in? I think I see...
We did have one question that came in about asking us to talk about COVID. Really, there are some, because the applications were filed during the pandemic, there were some applicants that addressed it in their applications. There were some that did not. We can just expect to have conversations with each grantee individually about any adaptations of this is just a perfect example of why we need to have our planning phase. If they need to make any COVID-related adaptations at the front of their program, we will address it in our planning phase calls to ensure that you are able to deliver services appropriately.
Great, thank you. I don't see any other questions at this time. So we can close out, and thank you all for joining us. We had fabulous attendance, and we look forward to working with you on your respective projects throughout the next few years. Take care, everyone, and have a great afternoon.
Thank you, everyone. Congratulations again. Bye.